Hello dear friends. We have this question. A newborn baby was bought with USG suggestive of thickened bladder, bilateral hydronephrosis and keyhole sign as shown. What is the next best investigation and diagnosis of this condition? So diagnosis here is posterior urethral valve. This posterior urethral valve is membranous fold that obstruct the lumina posterior urethra. So it is seen in 1 out of 4,000 live born males, and it is not seen in females. It is rare. Then presentation can be antenatal and postnatal. In antenatal, it is diagnosed in 1/3 of the cases, and there is bilateral hydronephrosis, there is dilated bladder, and there is dilated posterior urethra, which is also known as keyhole sign. So there is keyhole sign as shown in this image, keyhole sign. Now, so below you can see these three images. This is classification of posterior urethral valve. So it is Young classification. So this is type 1, which is most common. There is a ridge from, you can see here, there is a ridge from verumontanum that divides into two leaflets here, into two leaflets attaching to the anterior urethra. So this is type 1 and it is most common. Second one, which is very rare, which is very infrequent, this is non-obstructive type. There are mucosal folds proximal from verumontanum towards the bladder, as you can see here. Then this is type 3, which is also known as Cobb collar. This Cobb collar, there is annular or diaphragm like opening just below the verumontanum. So this is diaphragm or annular opening just below the verumontanum. So in addition to this, in antenatal period, there can also be associated severe oligohydramnios and lung hypoplasia. Now coming to postnatal period, in postnatal period, so there can be UTI, there can be bladder dysfunction, and there can be voiding dysfunction. Now investigations, so we can go for ultrasonography. As we discussed, in ultrasound we find bilateral hydronephrosis, there is dilated thickened wall of urinary bladder, and there is dilated posterior urethra which shows keyhole sign. And then we can also go for biochemical investigation like RFT, which will be deranged if there is renal failure, and then we can also go for DMSA. Besides, there is investigation which is a confirmatory investigation, and it is MCUG or VCUG, known as micturating cystourethrogram or widening cystourethrogram. So in this investigation, you can find there is dilated posterior urethra and there is thick walled bladder, thick walled urinary bladder. Now we have differential diagnosis. So first is agenesis or stenosis of urethra, and second is a very important condition which is known as megacystis microcolon intestinal hyperparestalsis syndrome. Now we have management. So treatment is ablation or resection of posterior urethral valve, which is done with cystoscopy. Now coming to the question, what is the next best investigation and diagnosis of this condition? So answer is MCU or VCU, that is micturating cystourethrogram or widening cystourethrogram.